Good afternoon.
Good afternoon. This is the House Appropriations Committee. It is Monday, February 2nd, 2026. It is nearly 3:30 p.m. and we are delighted to have with us Vermont Legal Aid, which also includes the Office of the Healthcare Advocate. So we have a few folks here and welcome. Have you presented in our committee before? Okay. So I know Fisher's been here before, but why don't we go around and introduce ourselves, and then you can introduce yourselves and start with your presentation.
Thank you.
Good afternoon. I'm Dave Iacovoni from Morristown. I represent the Lamoille, Washington district. Welcome.
Good afternoon, John Kaseska from Burke, and I represent 10 towns in the Essex, Caledonia district.
I'm Mike Nigro. I represent Bennington and Powell. Tom Stevens from Waterbury, representing the Washington Chittenden district.
Marty Feltus from 11, representing 5 towns in the community.
Robin Scheid from Middlebury.
Tiff Lumley from Burlington.
Trevor Squirrel, Underhill and Jericho.
Wayne Rush, Franklin, Berkshire, Highgate, Richford.
Is Mike on the screen still? Okay, so Mike Maricki from Putney and Dummerston, and then Lynn Dickinson, who's from St. Albans Town for the rest of the committee. So.
And I'm Bessie Weiss. I am Interim Executive Director of Vermont Legal Aid.
I'm Kylie Kuiper. I'm the State Long-Term Care Ombudsman at Vermont Legal Aid.
And I'm Mike Fisher, the healthcare advocate.
Welcome to all of you. Now we have lots of pieces of paper, so you can orient us and tell us what you want us to know.
Very good. So we decided I would start. First, I just wanted to talk a little bit about Vermont Legal Aid as a whole. Of course, the healthcare advocate and the state long-term care ombudsman are offices within Vermont Legal Aid. As a whole organization and along with our sister organization, Legal Services Vermont, we provide the core of the state's free civil legal assistance efforts. And we have served in that role for almost 60 years. I'm here today to speak to our budget request for state fiscal year 2027 and to the proposed elimination of the appropriation that funds the Medicare advocacy project known as MAP.
And that was the Department of Health.
EVA, yes.
EVA, okay, they were in last week and told us that, so it's, now we're gonna hear the other side of it, so, okay, thank you.
The MAP program has been at Vermont Legal Aid since it was established by statute in 1989. Since then, Vermont Legal Aid has been awarded long-term contracts by EVA to operate the program. The purpose of MAP is to ensure that dual eligible individuals, those are folks that are on both Medicare and Medicaid, receive the Medicare coverage to which they are entitled. When MAP finds a provider who is billing Medicaid for a service when instead it should be rightfully billed to Medicare, MAP works to recover those healthcare costs to the state. With the massive federal cuts to Medicaid in HR 1, otherwise known as the Big Beautiful Bill, securing federal Medicare dollars for Vermonters' critical healthcare need is now more important than ever. And I would like to now tell you about some of the accomplishments Vermont Legal Aid has had in the years that it has had the MAP contract. Since 2000, recovery for the state has exceeded what VLA has received from the state for this work by roughly $3.4 million. A couple of the other significant accomplishments for MAP was the success of a class action lawsuit MAP helped to win with the Center for Medicare Advocacy in Connecticut. The named plaintiff, Glenda Jimmo, was a resident of Lincoln, Vermont. In a 2013 settlement, Medicare agreed that it would cover maintenance, nursing, and therapies for people with conditions that would not improve. People with conditions such as ALS or Parkinson's or paraplegia. The settlement in this lawsuit expanded Medicare coverage for millions of people across the country. That lawsuit's titled Jimmo v. Sebelius. MAP appeals have been critical in getting Vermonters access to better health care in facilities and critical home health care. paid for by Medicare. Over the years that VLA has done this work, there has been a large shift to Medicare billing for home health care, resulting in a reduction of Medicaid billing from home health of $2 million from 10 years ago. Home health care avoids expensive longer stays or even readmission to skilled nursing facilities. And just to say a little bit more about that occurred, we believe, over time, that MAP was finding again and again that home health care was billing Medicaid when they should have been billing Medicare. And over the years, through those cases and through that education, that billing shifted. So I would argue that that shows that there's been cost avoidance by the operations of this program. We were therefore very surprised when we learned last week that the governor's budget proposes to eliminate MAP, especially because we were awarded a new 5-year contract in November after a competitive bid.
In November.
In November, yep, 2025. We just, the new contract term began January 1.
How did you find out that your contract was getting canceled?
We were alerted last week. I guess, Mike, maybe you can take that.
Did you hear it here?
We've heard it here, yes.
So they didn't tell you?
No. Well, while it is true that the contract price has exceeded recovery in recent years, there are multiple reasons for this. At the onset of COVID, we were directed by DVA to cease recovery efforts for several months. Recovery from skilled nursing facilities remained difficult with the ongoing disruption of COVID in the years following the pandemic. The Genesis bankruptcy of the 9 nursing homes that they ran in the state affected 9 facilities, resulted in MAPS freezing over $200,000 in potential claims. We sought advice about whether there was anything we could do about that from the Attorney General's office, and we were told there is nothing we can do. Medicare Part C plans added a whole additional layer to billing appeals. The first appeal was to the Part C plan. The second was to Medicare. Both appeal processes had multiple levels, making it nearly impossible to successfully appeal wrongly denied claims. And as you know, there are no longer Part C plans.
Part C is Medicare Advantage for people who don't know what Part C is, right? Yeah.
Which brings me to what MAP is working on right now with DVA to improve recovery. In our bid last fall, we acknowledged the challenging landscape of declining Medicare reimbursements and proposed solutions. These strategies are currently being implemented, such as meeting with DVA staff to discuss ways to improve data collection and provider education, holding a training just last month for DVA's provider relations staff to train on Medicare coverage standards, plans for multiple training sessions with healthcare providers on the importance of proper Medicare documentation requirements for successful appeals. It's harder to bill Medicare than it is to bill Medicaid. So providers need education and training to, or help to properly bill.
Why is it harder?
Leah, who works in the program, Leah Burdick, attorney for MAP and our ELP. I think there are I know there are multiple layers, redeterminations, multiple layers, but
So my name is Leah Burdick. I'm an attorney in the Medicare Advocacy Project and do these appeals. The levels of appeal for Medicare for these types of claims are many. They are the documentation requirements are very nuanced, in particular. There have to be certifications, there have to be doctor's orders, a person has to be considered confined to the home, they have to be in skilled care. All of those things have to be documented, and in order to win an appeal, to get coverage, all of it has to be very clear in the medical record. So sometimes when we're attempting to provide evidence to a judge, even after we get through all the first levels of appeal, the judge is looking at what is in the medical record, what can they use to determine that coverage can be awarded. If providers are not giving us the evidence we need because they don't understand Medicare coverage requirements, we cannot win appeals.
And we have plans for quarterly meetings with DEVA to review data quality and progress. And now, between cases opened in 2025 and last month, MAP is currently pursuing over 1.1 million in Medicaid recoupment. Finally, we do not believe the state has complied with the statutory criteria for ending MAP. The statute requires 2 criteria be met before the commissioner of DEVA is permitted to end the contract for this work. Those criteria are: the amount of the state's share of recoveries during the preceding year did not exceed payments, and the commissioner determines, based upon information from the contractor, us, providers, area agencies on aging, and others affected by the program, that is not accomplishing its goal of protecting dual eligible individuals from improper denials of Medicare coverage. So that's at 33 VSA section 6703. In addition, it seems unlikely that plans currently exist to bring this work in-house, given the newly awarded contract, the lack of a commissioner's determination, and the level of expertise that is needed to do the work. The team of attorneys and paralegals assigned to MAP at VLA are experts in Medicare and Medicaid law. By losing MAP, Vermont would lose its billing watchdog. It is easier for providers to bill Medicaid. There's good reason to believe that providers will increasingly bill Medicaid instead of Medicare. We therefore are asking this committee to keep the funds in the budget necessary to continue MAP. We would be happy to report back to the committee next January on our progress.
I have a question, and I'm wondering if you can submit that to us too.
Yes.
That would be helpful. Go ahead, Mike.
It's been a little while since I've worked in anything related to this subject, but Medicare, is Medicare still a significantly better payer for most providers than Medicaid?
I don't think that it is, but Medicare, now, Medicare, if I say anything wrong, Leah, Medicare provides a set of services for people in home health care, and upon discharge into a nursing home from a hospital, that is a higher level, better level of service.
Right. So I guess, and I just partly ask it with a little bit of surprise, because it seems like for the most part, it would be in the best interest of providers to be ensuring they're billing Medicare. And why they wouldn't be taking a more active role. And I'm not sure, and maybe this is a question, but if MAP is mostly working with smaller providers that just don't have the resources, or if it's
Everyone, and they're working with, they're looking at billing data from throughout the provider system. So home health care agencies, skilled nursing facilities, and other providers.
And can I just add, just in case anybody's not tracking, a reminder that Medicare is fully federally funded and Medicaid. So this is saving state dollars when we can get a claim covered by Medicaid.
certainly, yeah, and certainly understand why it's beneficial for the state. Again, like they said, it seems, my assumption would have been that it would also be beneficial for providers as well.
If Leah wanted to say something, is that okay?
Go ahead. Oh, yes, of course.
So I think part of the analysis is that Medicare pays later. It doesn't happen as quickly for certain home health care plans.
Right.
It can take longer to work through the system. And so providers get paid faster and they bill Medicare. So they want to do it that way. when we tell them, part of our system is we have what's called a third party liability demand bid. When we tell them, you don't have the option, we've determined that this might be eligible for Medicare coverage, you have to bill. They listen to us, they bill it, sometimes Medicare covers it, sometimes we say, oh, this was an improper denial. We take the claim and file the appeals and go through the process of it, can speak with the judge, who will provide coverage. That all takes time. So part of it is that it's just a longer system. So providers, they want to get paid. So that's why often we see that they're not billing Medicare right off the bat.
Wayne, go ahead.
So Medicaid doesn't require as much documentation, is that? That's what-
That's fair, and if you file for an appeal, you get to go immediately to the Human Services Board and your appeal is done. Whereas with Medicare, there are something like 4 levels of appeal, redeterminations, reconsideration, and
So the flip side is, given the scrutiny that some states are getting into programs these days, is there any potential liability that we have either one of those programs, given the nature of the providers maybe not always doing things the way they might probably be done?
I don't know whether I don't think that there is more liability to Medicaid or Medicare by anything that the MAP program is doing.
Thanks.
The questions on MAP? Tom, do you have a question?
No, it's just, I think just reiterating that seems to be a massive difference of opinion.
Well, they signed the contract in November, we're talking 3 months ago,
That's right.
A 5-year country.
After a competitive bid.
and you found out because they told us in our committee, that doesn't seem.
I mean, what we were told is that they didn't feel that the return has been sufficient to
Right.
justify the expense. And what I'm hearing is that even if that would be something that you could only determine some months into a contract or years into a contract rather than 2 months.
Well, in our contract, there are provisions that if DEVA does not think that we are performing in accordance with what they consider to be the deliverables that they want from us, then there is a performance improvement plan process right in the contract.
And is
That has not been.
and they don't have like a 90-day out on the contract or anything like that?
Well, I think the performance improvement plan gives us a 90-day opportunity to improve performance.
They must have an escape clause, like, do they have to give you 90 days notice before they cancel? What do they have to do?
The standard state contract on its first page, which is the standard contract, it has a 30-day, it has the typical 30-day termination notice.
Okay,
Within the contract, it gives us the opportunity for a performance improvement plan, but I'll note, there has been no communication to us thus far about our performance.
okay.
And that appropriation is how much? 500?
The contract amount, so the contract now, since it's on a calendar year, so the contract amount is 520,000 or 529,000.
529.
That sounds about 5, I could look at, but I think it's 5.
I think it's fine, that's,
I've got it, but yeah,
okay,
And that's on
Dave?
a calendar year.
it's a calendar year.
Yeah,
Yes, thank you. Can you tell us how many claims you appeal annually? And is there a lot of claims that we just don't have the staff capacity out there that could also be appealed? Do we leave a lot on the table?
Leah, do you have numbers on that?
think in 2025, we 8
Yep.
cases. We have currently, we have an expert paralegal who's been with MAP since its inception. Her name's Leslie Creek. She's worked in MAP for 40 years. She's an expert paralegal in all of these types of claims. She assists with reviewing the data that we get from DIVA about all the different claims. And then we also have me as an attorney reviewing claims and filing appeals, reviewing cases. And then we have also another part-time paralegal who's new that we're training on these processes. So we do our very best with all the three of us to review each case that gets assigned and for merit, because not all of the, remember what I said before, Medicare has very specific standards for what they will cover and what they will not, and the nuance of all of that. Some claims are not right, some claims are not appropriate for medical, others are just all a standard. But we review every single one that we get from DIVA. So it's, we touch every one, and then the advocate determines whether there's merit.
So if I can so DIVA filters them and decides which ones you should chase?
No, so they give us the data on everything.
Okay, so every claim you have,
Right.
and what I'm trying to discern is whether there's a lot more opportunity for savings here, but if we only had the staff to do it.
I think it would be fair to say that MAP would be served and the state would be served with more staff.
Yeah. I have always felt, Madam Chair, that we should be, if anything, doubling or tripling this. There's many opportunities left that we can't adequately chase, and that's how I would achieve the savings in Medicaid as opposed to eliminating the program. I've worked with this for some time.
Okay. Other questions about this particular item? Sounds like we have some more digging to do.
Or digging.
Okay. Yeah, go ahead.
I could go on with the rest of our budget request. Is that what,
Sure, yeah, I was trying to figure out, this is your time in with us, so let's do that, yeah.
moving on to our appropriation request, as I stated, BLA and LSV, Legal Services Vermont, are the only providers of a range of core legal services throughout the state. We offer free legal advice and representation to low-income Vermonters from 4 offices located across the state. We operate a statewide legal helpline, providing quick legal advice, information, and referral. We maintain a website that guides Vermonters on how to solve their legal problems on their own that gets over 600,000 hits per year. We field 26,000 requests for legal assistance every year, and last year we directly assisted, to some degree, 18,000 Vermonters. We provide full representation to approximately 2,600 to 3,000 cases per year. Despite the overwhelming need and increasing demand for legal services, this will be our 3rd straight year that we have not received an increase in our appropriation from the Agency of Human Services. Level funding is hitting us especially hard because of significant federal funding cuts and annual inflationary increases to our costs, especially in health insurance premiums. In state fiscal year 2025, Vermont Legal Aid lost little over $4.5 million in federal funds. 1,275,000 of those funds were from HUD that for 19 years had funded our housing discrimination project. And a little over $3.2 million in funds were from the Emergency Rental Assistance Program that funded our Housing for Everyone and homeowner legal assistance projects. Admittedly, that was pandemic funding, but it obviously still had had repercussions. The HUD funding was not pandemic funding. The HUD funding was funding that we had been receiving for 19 years. Those losses and level funding meant the painful loss of a total of 11 staff between Vermont Legal Aid and our sister organization, Legal Services Vermont. We lost 9 attorneys and 2 paralegals. An increase in our state fiscal year 27 appropriation would compensate us for inflation, restore 2 staff attorney positions in our poverty law project, and provide more funding for our helpline. The poverty law project provides general legal services and is being squeezed. As a greater percentage of our appropriation goes to mandatory legal services such as involuntary mental health treatment cases, protective services cases, and Act 248 cases. Specifically, we are asking for $535,620, an amount that will compensate us for inflation and fund those 2 staff attorney positions. Now, maybe to explain that a little bit more, we get a contract with, we have a contract with the AHS that requires us to do 4 things. One is to represent people subject to involuntary treatment, involuntary hospitalization, and involuntary medication. The other pieces are that we are required to represent people with developmental disabilities in protected services cases, and they're also required to represent people with developmental disabilities who have been charged with crimes that go on to something called Act 248. But in addition, the 4th item that we're supposed to do is to provide legal services to people that would be that are covered by the Social Security block grant. So those are the folks that we serve in in eviction cases, housing cases, benefits cases. So the point I'm trying to make here is that when we get level funded year after year, the amount of funding that goes to those mandatory services increases, and it squeezes out those other core legal services.
So you've talked to the agencies and administration about this?
I did speak with Secretary Samuelson. She was sympathetic and complimented our work. And she said that essentially I came to her in October, and essentially that I'd come to her too late. So lesson learned for us that we need to be speaking with the agency sooner. But I did have that conversation, and we did go through this.
So if I'm adding up all the different things, you had said Vermont Legal Aid, 545, 600?
Well, that's part of our.
That was one of the numbers. Did I get that number right?
$535,620.
530, okay. And then, I'm just reading some of your papers. The Vermont Ombudsman, is there something that has all of that? Because I didn't get that.
It's documented.
I didn't get that one. I got 6 of the 7, and that's the 7th appropriation. Okay, total is 1.4. Right. Okay, all right, so I can get that. That's fine. I'll find it.
The total to restore MAP funding provide us with an inflationary increase, fund 2 staff attorney positions, help fund the struggling helpline, and provide some funding to the immigrant minor guardianship project is what brings us to the total of $1.4 billion and some. $1,414,620.
And then you'll also see a request from each of the VOP and the HCA.
So that's what I was wondering what so VOP has 275 and that's not on this list. And you have 450 and that's not on this list.
And then tenant representation, they have to.
Appropriation.
Yeah.
Still need a clarification.
Go ahead.
On this document, the German habit indicates that HS currently funds you at 2.6. So you're asking for 1.4 on top of the 2.6?
Correct. 2.6 exactly right. Yes, 2
HS.
yes.
But no, math funding comes from DIVA, or the right map comes from DIVA.
MAP comes from DEVA.
Through AHS.
But it wasn't part of the 2.6 million.
Yes.
Right.
That's correct.
That was
No, I'm sorry, MAP, no, MAP is not part of the 2.6 million.
So what we don't have on here is what they're proposing for 27. This only goes through last year, and 27, you just told us
We
that you lost
understand level funding,
minus the 529.
right?
That's how we get. So this is FY 26.
Right.
And that had the 529 in it. And they've now calendared.
No, the 2.529 wouldn't have taken the 2.6. They just got the contract in November.
But some of the previous contract was in here.
No, this is what we passed as fiscal year 26 last
Yes, I know,
June.
but if they just got a new 5-year contract,
Did they have the contract before?
you had a contract before, they had a contract for 60 years. Or something you said.
I mean, well, we've had a contract since 1989.
18, 19, okay, 40, 36 years. Whatever it is, okay. So part of that MAP contract, the old contract is in the 2.6 million.
2.6 billion, let me see, restore MAP funding. Well, I don't think, the 2.6 million is just the AHS funding that we've been receiving at the same, level for the past 3 years, now would be 4 years. The part of our, so that's not, we included it. I'm sorry, we included the $529,000 that would restore a map in our total ask.
Right, for 27.
Correct.
But what I'm trying to figure out is if you had a MAP contract before,
Mhm.
how much of that was in that 2.6 million?
It wasn't.
It looks as if, that, like, holding up, that,
Right?
what you were holding up was.
But that for 27 would go down.
Right, but we looked through that. I think they're also talking about the current base funding.
I'm reading this, it's like
The two.
I'm just reading off the paper here.
Yes.
But I think there's some double counting going.
Or
I think that-
27 number.
That's
One-
from the last
This is 27 number as put forward by
No, that's what we
by the
don't have.
administration.
Right.
advocacy.
That's what we don't have.
That's what I'm
Which
trying
may
to get.
be, which may be 2.1 million.
But if this total,
Right.
total state calendar year.
Should we work
Where's
on
total
figuring
state?
these numbers out?
Yeah, so because the other part is that that's on a calendar year.
Yeah.
So we're still in FY 26. So your FY 26 is going to go down if this contract gets canceled. Because it started in January. So half a year is canceled, so that would be 214.5 or something like that, 264.5.
This is the other thing for why we all want, where I
Right.
would propose to put them, all the legal
Right,
services.
we need to see it all,
Rather than,
Right.
pick
It's all
it
over the
from
place.
Here, and here.
one from column A and one from column B,
Yeah.
yeah.
Because I don't know what number it's gonna be at in the commission aggression stuff, so. Continue on if I
Okay.
find it all.
So do you see what I'm saying is I just want to be sure we're not double counting and maybe you need a revised 26, under the assumption that this is canceled or how much
I
of,
see what you're saying.
see what I'm saying? Because I don't want to double count,
Say.
doesn't, doesn't look, you're not really going up as high as, it looks like you're going up if that MAP contract is already in for FY 26.
Right.
Mike, what's your line, you know?
E300,
What is it?
E300.
Oh, you're in the central office. Okay.
Let me see, though, but the map. So we're in January for fiscal year, state fiscal year 2027. That would be a cut of over $500,000
For 27
for 27.
next year,
Yes,
starting July.
Okay.
yes.
All right, so what I'm hearing from my fabulous JFO staff over here is that the amount in the AH's contract is still the 2.367 for FY 27.
Yeah, that's just the 100 line.
Right, that's the E300 line, but this MAP thing must be somewhere else.
In the DEVA budget.
But so then they're not asking for this in the 300 line. It would be, the 529 has to be somewhere else. So in fact, it ends up being, we're gonna have to work on this.
So the E300 line has been HCA for a lot of years.
For you,
since
right.
2011 or something. 3 or 4 years ago, a couple of, the legislature increased legal aid funding. You can see it on there.
Yes, we did that in for 24.
Put it in that section where it has sat since then. That's not all of legal aid's funding. It's just an increase that the legislature gave in that, and it has carried forward.
The 650,000. There's two line items there. There's that 650,000, and then there's the, what is it, 1.4, about 1.4 million, I think. And that's the other AHS. It was just, it's very difficult. But it's,
Tom, go
So
ahead.
just what we have here from the commissioner. This is their recommended budget summary. So in E300, it's listed as funding for the Office of the Healthcare Advocate Vermont Legal, Vermont Legal Aid. Of the funds appropriated in this act, so $2,406,000 shall be used for the contract with the Office of the Healthcare Advocate. So does that represent the $500,000 that's missing? No. So 2 is 1.7 plus for Vermont legal aid services, including the poverty law project and mental health services. And then 650,000 is for the purposes of maintaining current Vermont legal aid program capacity and addressing increased requests for services, including eviction prevention and protection from foreclosure and consumer debt. So again, no numbers here matching up in what we were talking about earlier was like, we really need to get a handle on all of the funds coming to legal aid from different sources and that live in different places so that we can have a number or a series of numbers.
I think it makes sense for us to work with maybe joint fiscal, to figure out where all the money sits.
Yeah.
Legal aid, we have not, HCA is easy, we've got a line item, but for the rest of legal aid, I think it's particularly hard to find. And
That's just part of it. I mean, again, from my time here, I've only focused on the money that might go to housing issues or housing projects or a poverty law project or, but not anything related to healthcare or TIFA or anything else like that. So I would just like to have, I asked James last week to, scour the budget to come up with a list of what actually legal aid gets.
Right.
It's not as, I'm hoping that it's more useful if we have a whole list. Even if it is in different parts.
Right, just put it all
understand
together
what
in
the
one
full
place.
accounting is because the confusion that can come is just, as you can see, our heads are starting to spin about just the differences in the numbers and where they're going to and how they're getting there. So
Right, and those two numbers you read, the 1.7 and the 650 do equal the 2367994. So that actually ties.
yeah.
That may not be, but that's not everything.
right.
So,
And then again, like I said, there's the tenant representation pilot program, which they're gonna ask, and there's a weird thing where
Yeah.
we have funding till October or something like,
Right.
so there's not a set
Yeah.
number there yet.
So that would be good to get that all.
Yeah.
Figured out, all the different places, and if we can actually put, the budget numbers next to them, like we know this is E300 and where the other ones can be found, and then we can map it out and figure out what we're talking about.
Along with the federal cuts as well, right, and how they affect the program. And so,
Yeah, I want to find out where they all sit in our budget first, and then we can deal with the other parts. Okay, Wayne?
I was assuming that you were a state agency, but you're a nonprofit law firm independent. So human services is paying you by grants. So you're just getting grants from human services.
So, I mean, I think one thing is worth sort of saying, I understand it's a little confusing. You have three of us up here, we're all part of legal aid.
Yeah.
Kylie and I are part of two parts of legal aid that are statutorily defined with duties and responsibilities and a responsibility to run our projects, the long-term care ombudsman and the healthcare advocate. And so that's why you have the three of us with three different, even though we
Right.
house at legal aid, we have independent projects that we're
Right.
tasked with running.
Right, and legal aid is also in statute, right? So this isn't like,
I'm just gonna get my head wrapped around the administrative parts of this.
right, well, once we figure out where all the money is and goes to, then we have a lot more to dig into. Let's put it that way. Sounds like Tom and maybe James will be on the case, and with the help of other folks in the viewing audience from legal aid who can help us out.
Recognizing the time, can I ask how long would you like us to?
I don't know whether we're kind of at this point done and we get you back. I'm kind of feeling like we need to get organized in how we think about it. Because there are all these disparate pieces. And then perhaps some of the written testimony, Bessie, that you read to us, if you wanted to type that up, and we can.
Sure,
can put that-
I do have more.
I think that-
But you think,
I
okay.
think we do it when we have all the pieces, because we'll be in better shape in our heads to listen to it also.
Okay.
If that's all right. Yeah, go
So
ahead.
I want to finish just like, just open up the confusion factor of, just seeing a line that they have 10 different projects, from the poverty law project to,
Disability and.
Long-term care.
and a lot of those receive funding that are specific to those particular projects. And so if they didn't serve as many people in one particular project, they can't reutilize that in a different one. So getting that clarification, I think, will help us
Yes.
and hopefully the body to understand that it's not just one line item for legal aid
Right.
and who it's affecting throughout, because I can name off at least 4 different committees that you do work with, and probably more. I mean, human services, healthcare, housing, judiciary, just to start. So it just.
Right, and
wants
you
to
can't
start-
move the money around. It's not fungible that way. It's like, it's a such for the specific thing, and we have no authority to move that around to other places.
And I just want to maybe make one more point about maps, since, and that is that losing that funding would be particularly now devastating to Vermont Legal Aid, not only because, and indeed, like lots of our other funds, it can't be used for anything other than that. But what it does do is that it helps us to be able to have a full-time attorney like Leah and other staff people in the elder law project. Because of this, and that's our project that represents people over 60, particularly in abuse and neglect cases, improper discharge cases, social security, and if this goes away, then we don't have a full-time positions for people, and
You're gonna lose a lot more than what is the MAP.
Yes.
That's what you're saying.
that's what I'm saying.
Okay. All right, what an afternoon. Thank you. Thank you very much. We will, to be continued is where we'll leave it for that. And we really appreciate you coming in.
Thank you.
Okay, thanks. And committee, that's it for today. But we will be here at 9:30 tomorrow morning with the Cannabis Control Board. I'm looking at Mike, yours. And then VSAC is coming in. And we may have a little bit of a break. We're trying to build in a little bit of breaks here and there so that you can meet with your portfolio people or just read your stuff and get familiar with it and check up on people. So we're not gonna necessarily like nose to the grindstone until 8 to 4. Yes,
I've met with VSAC twice.
great.
We met like last month or.
That's right, you're not gonna be here.
Tomorrow, and he and I spoke on the phone, or had a Zoom call this morning.
Great.
So I'm up to speed on.
Okay, and I chatted with him on Friday
Next
too. Yeah,
I'll be up.
and you're both out tomorrow.
Yeah, not together.
Correct.
Well, the record show.
Things going on.
I'll be here. Okay, Dave. Why don't we go off live?